Hello, it's Dr. Stephen Tugbiyele here, your UroGYN doctor, and in this video we're going to talk about pelvic pain and answer the question, what is pelvic pain? And before we get to that, let's talk a little bit about some female anatomy, and I actually have a little diagram here that will help to illustrate. Okay, so let's see here. So this is a side profile. We're looking at a woman from the side. This is a pubic bone in the front here and the tailbone in the back here. The vagina is in the middle here, and this is the uterus and the ovaries, and these are the intestines here, and the bowels, we call it. This is the bladder here, urethra, and this is the anus, the rectum, and the sigmoid. And so in the woman's pelvis coexists so many different organs. We have bones, right? There's a pubic symphysis, our bones here. There's also a set of bones, muscles that are not really shown in this diagram, but they're the muscles of the pelvic floor, the Kegel muscles that exist kind of in this area here. And they are also supported by nerves, okay? So we have nerves, we have muscles, we have ligaments, we have bones, okay? And then we have the GU, or genital urinary. So we have the bladder, urethra, and that's connected to the uterus, and the kidneys, which is not shown in this diagram. But we also have the gynecologic organs. We have the vagina, the uterus, the ovaries, okay, and the fallopian tubes. And then we have our gastrointestinal tract. This is our anus here, rectum, and then we have our colon here, and that then connected to the intestines. So many different systems that are in the female pelvis here, and any of these areas could be a source of pain. So definitely I have had women over the years be referred to me as a board certified urogynecologist with pain, and they've been told, oh, I've had a UTI, and they've had cultures and upon urine cultures and nothing's been found. Or they've been told, oh, it may have been that 2 centimeter or 1 centimeter cyst on the ovary, and that's not it. And so getting a thorough evaluation of the pain is quite important. When we think about pain, again, we classify based on organ systems. Is it due to muscles, bones, ligaments, or nerves? Is it from an injury to the pelvis? Is it from childbirth? Is it because of some abnormality or curvature of the back, scoliosis? Some patients of mine who've had pain is because of a motor vehicle accident or a fall, or so some sporting injury, or so different reasons that they have pain, or they may have surgery. They may have screws in their back, or they had spinal surgery, lumbospinal surgery. So there are different reasons for their pain that are related to their bones, ligaments, nerves, muscles. Or they had tear or some sort of the ligaments. So there are different reasons for the pain in that sense. If it's a bladder pain, it could be something called interstitial cystitis. It's a sort of condition that causes pain, frequency, going frequently to the restroom, urgency, waking up at night to empty the bladder, a lot of discomfort. A lot of women have this. That's not related to a bladder infection, and a lot of women have been treated with treated with antibiotic after antibiotic, and that has not been a thorough solution. And they've seen doctor after doctor, and they are frustrated. But there are conditions I see, and that has to be treated separately and differently. Or is it due to the gynecologic organs? So yes, if there's a fibroid, abnormal growth in the uterus, or if there's a cyst on the ovary, or if there's something called endometriosis or adenomyosis, those are conditions specific to the gynecologic organs, and that would need to be treated differently. Or if it's a gastrointestinal issue, it could be diverticulosis, or some people may have a mass or a condition that causes bleeding or pain, or some people may have something called irritable bowel syndrome, where they have spastic movements of the colon, and that could be their source of pain. So it's very important to classify the pain well, and when we evaluate a woman who has pain, of course we do a thorough history, gathering all this information. Where's the source of the pain? What are triggers? What makes things better? What makes things worse? What patients have tried before in the past that has worked or not worked. A thorough physical exam of all these systems that I just mentioned, and so we can arrive at a suitable solution. Now, if it's a musculoskeletal type of solution, it may require pain medication. If it's a woman who has muscle spasms, they have tension in the pelvic floor muscles caused by stress or an injury or surgery, past back surgery, and then now they have tension in the pelvic floor muscles. They have pain with intercourse and those sorts of things. So that could require pain medicine, muscle relaxants, vaginal muscle relaxants, oral muscle relaxants, or even pelvic floor Botox. That's another solution. Pelvic floor physical therapy is another solution. If it's a gynecologic issue, it may require either medication or in some situations surgery to help to relieve the condition, whether it's endometriosis, scar tissue, or adenomyosis, or cyst on the ovary or sore. If it's a urologic issue, it may require a procedure to help to stretch the bladder, cystohydrodistension, or it may require perhaps medicines to help to relieve the inflammation in the bladder. Bladder installations we do in the office. So there's so many different, or pelvic floor physical therapy. Some patients ascribe to that, and that too has been very helpful for them. And if it's a gastrointestinal issue, then we work with the gastroenterologist to devise a solution in that situation as well. So when we think about treatment solutions, I like to categorize them as natural solutions. So there, of course, is an important role for a woman's diet, alkaline diet, reducing acidity, things that can cause more inflammation, things that don't digest well, like spicy foods, dairy, meats, highly processed foods, fast foods, those kinds of things can be triggers, or coffee, tea, sodas, artificial sweeteners, alcoholic beverages, acidic juices, those things can be triggers for pain, so we have to talk about that. Exercise is very important. It delivers normal endorphins to the body. People feel better about themselves and their bodies feel better, so that's also a solution. And stretching and those kinds of things. Reducing stress is important. Pelvic floor physical therapy, I would send patients to a specialized physiotherapist who you would see for once a week for about an hour over the course of 2 to 3 months to help to stretch out the muscles if that's the issue, or the nerves, or to work the areas. It's called myofascial release, to help to relieve the tension, and particularly if it's related to the muscles and organs. Some patients, yes, ascribe to essential oils. They use a heating pad and they use essential oils to relieve their pain. And there are different essential oils. These have to be therapeutic grade essential oils, of course, that go on the skin. So whether it's lavender, sage, there's one called dragon thyme that helps to relieve menstrual cramps. So there's so many different essential oils that some women have used as a natural solution to their pain. There are medical solutions. There could be medications, either oral medications or vaginal suppositories that can also help. And then there's surgical solutions that can help to relieve the pain if the medical and or natural solutions aren't adequate enough. And so I know I mentioned a lot. Again, pelvic pain has to be thought in a multidisciplinary, kind of in a very comprehensive manner. It's not a one-size-fits-all. And so seeing a board-certified urogynecology specialist like myself is very key, because we've been trained to really evaluate these conditions in a thorough manner. I like to tell my patients that they don't have to live or put up with it. There are good solutions that work, are safe and effective. And so seeing a board-certified urogynecologist like myself is the next step. If you'd like to get more information about this, you can visit my website, Dr. Dr. Steven with a PH, Tugbiyele, Tugbiy.com. So that's drsteven2biele.com. Or you can also visit my LinkedIn page or my YouTube channel, Dr. Steven Tugbiyele, for more information. My office website is northsidecenterforurogyn.com, and that's all one word, northsidecenterforurogyn.com. My office number is 470-325-1280. That's 470-325-1280. I'd love to be able to meet you, get the solution of your pain, and help you live a better quality of life. Okay, thank you. Thanks for listening. Until the next video, take care. Be well.